Now, as the world gradually adjusts to the new normal, many doctors are now taking to telemedicine to treat and provide support for their patients. What this simply means is that they can see their patients for routine checkups, diagnose diseases remotely via the internet, while saving office visits for emergencies. One leading indigenous non-profit foundation at the forefront of the fight against COVID-19 set up the MedAssist COVID Partner Line, a telemedicine platform providing medical advisory on COVID-19 and mental health support to Nigerians who may have been exposed to the virus. Joining me via Skype to discuss COVID-19 and telemedicine is the coordinator, MedAssist Program, COVID-19 partner, Okpeyemi Orinowo. It's nice to have you join me, Okpeyemi. Thank you very much for what you do. And let me say Happy New Year at a time like this.
Happy New Year.
Great.
Happy New Year. Thank you for having me.
Great. Now, talk to us basically. We have heard of telemedicine before, and it has been deployed and it's being used in parts of the world, including Nigeria. But if we relate it particularly to COVID-19, how is it helping?
Thank you. So, I mean, it's a peculiar situation. I mean, I believe that COVID-19 has actually presented a peculiar opportunity to actually fast-track the usability of telemedicine as a viable platform for healthcare service delivery. I mean, if we would, I mean, we're all aware around the restrictions that COVID-19 has presented us, especially in the area of movement. I mean, we have situations where hospitals are even skeptical to receive people, and even limited number of hospitals who have been accredited to even treat COVID-19 patients. So it has never been a greater time for us to scale up the adoption of COVID-19 as an alternative platform for healthcare service delivery in light of the realities that COVID-19 has presented us. And this is also against the backdrop of pre-existing challenges to healthcare service delivery in Nigeria, even before COVID-19 came. I mean, we had doctor-to-patient ratio in Nigeria to be about 4 to 10,000 people. I mean, in the UK, we had numbers to be about 26 to 10,000, or the US, 28 to 10,000. So even before COVID came, we're dealing with a very serious lack of access, equitable access to healthcare service delivery. And we believe that, I mean, with what we're seeing, telemedicine is looking like the answer to ameliorating this challenge.
All right. Now, when it comes to using telemedicine to diagnose, how affordable is that for people? Is it different from the observatory when a doctor is trying to observe a patient closely, or when you engage in telemedicine, does it incur more costs?
Okay, so it doesn't incur more costs. So one of the advantages of telemedicine is that it is cheaper, both for I mean, the two sides, the demand and supply side of the service. I mean, for citizens, I mean, the cost of having to transport yourself from your comfort zone to a physical hospital, the cost, the downtime of having to wait longer hours in the lobby of an hospital before you see a clinician or a doctor or a nurse. I mean, all that has been reduced. Also, on the side of the hospital as well, the care service providers, there's also reduction in downtime. You know, the doctors are able to maximize their time and also reduce the risk that contact can perhaps bring. You know, being the healthcare or frontline workers, they're definitely at risk. But telemedicine does offer that avenue to be able to, you know, a win-win situation where, we're deploying videos, you know, so you can observe the patient like you would in real time. Yes, there might be a little limitation to, you know, seeing the person in real time, you know, but to a certain degree, and based on what we've seen on the field, it's able to still deliver the service efficiently. So definitely, telemedicine is looking like the transformative avenue for healthcare service delivery in Nigeria in particular.
All right. Now, one of the areas we would like to know is the accuracy of the diagnosis through telemedicine. Now, the point there is, people tend to describe the way they feel, and sometimes it might not be accurate based on what the symptoms would be, but they use their minds and all of that to describe. Now, when it comes to actually diagnosing and getting to the root of what the issue is, since you're not observing the patient directly, how accurate are the diagnoses through telemedicine? Okay,
so diagnosis comes in let me say two forms. The first form now has to do with observation. So there is a lot that relies on observation, and through video conferencing, which is a major component of telemedicine. So to engage with us now, you could go through the web and you could go through your feature phone. So there's a smartphone component for people who have access to smartphone. We could talk to you and look at you in real time via just the same way we're having this conversation right now via Skype to talk to you. Now, the other bit of it right now is there's also a limitation to what you can see. People can say they are feeling this certain way, but a test is required for confirmation before prescription will be given. In that instance, we run collaborations with diagnostic labs. So you're being prescribed, oh, okay, go do XYZ test in this particular center. So part of what we've inculcated into the MedAssist COVID partner line telemedicine platform is integrations and partnerships with existing testing facilities. So after consultations with you, and it is required for follow-up verification before you're being prescribed drugs, we refer you, so on arrival there, they're expecting you, you've been given a time. So once you do those tests and all that, you have the opportunity to also feedback that test back to your clinician, the person handling your case file. And right there, prescription is also being made. Also through referrals integrations that we built with pharmacies who are also able to, dispense drugs to you. So it's an integrated system. It's aside from delivering the service in itself, it also runs in collaboration with all the other value-added services required for successful case treatment.
All right, when it comes to the convenience of use, how convenient it is for doctors using the telemedicine generally. We know that the new generation or a new generation doctor who may be tech savvy and all of that will be more, it will be easier to use than maybe one of the older generation medical doctors. Talk to us from that window, how convenient this is for medical personnel and even doctors.
Absolutely, absolutely. So one of the challenges that telemedicine has had before now is adoption. People are resistant to change, and people don't sometimes know what they want or how well a service is until they've tried it. So definitely there is that fallback generally of people. It's literally an emerging field in this part of the continent, in Africa and in Nigeria. It's been around as an idea, like you initially mentioned, but in terms of the adoption rate, it hasn't been as impressive as you would expect. However, in light of COVID-19 is offering that required push, because there is a necessity right now or constraint that people have, but people's health needs haven't changed. In fact, it has increased. And you need to access a doctor. So I myself in the course of the lockdown needed to talk to a doctor at a certain point and all that. I had to engage in the platform. Likewise, so many other people. So it is now afforded people the opportunity to see that you could get healthcare service delivery through that platform. So for healthcare workers, in our experience on the MedAssist COVID partner line, founded by the Muritala Mohammed Foundation, yes, we've seen healthcare workers who come in and they still want the hustle or the energy that comes from physically seeing a patient. It's a case of adoption, of trial over time to see that you get the same kind of satisfaction you would get if you were seeing a patient in real time or if you were seeing the patient via video conferencing. So I just liken it to this kind of conversation we're having as well. People have to, we're witnessing COVID-19 has presented an opportunity for both the healthcare service providers as well as the clients, the patients, to be able to see that it actually works and they will get the same satisfaction from the service delivery. Now it's cheaper and it costs you less and it's less stress, so it's just being able to showcase and increase that adoption level for people to see that, you could actually get healthcare delivered to you via technology.
All right. Now, would you say this is the future of medicine and diagnosis generally? Would you think this has come to stay or is just going to be part of how diagnosis is being taken?
Okay, so absolutely, but I would say even beyond that, it's that we're dealing with a situation where, we have over 200 million Nigerian population, over 200 million people, and about just 4 to 10,000 people 4 doctors to 10,000 people in a population. We have, before COVID-19 came, we were dealing with almost a comatose healthcare system where people are unable to access basic healthcare. That's the reality of it. So what telemedicine is even offering, aside from being the future of healthcare service delivery, even for countries that have significant numbers, is that in our own instance, we're not even able to cater to the needs of our population, especially those ones in the rural areas, which are particular interest for us. How do we ensure that we're able to deliver healthcare service delivery at the very lowest level to people in rural, marginalized, low-income people across the country. So part of what we have done is to deploy to ensure that now you could talk to doctors in Igbo, Yoruba, Hausa, and Pidgin English. We contextualize it so you don't have to speak English language. We're bringing the service to you at the language that you understand. So from anywhere that you are, even by using a feature phone. I mean, Nigeria's mobile phone usage now is about 172 million, according to 2019's GMA report. And smartphone usage, according to Global Systems for Mobile Technology, is 53 million as we speak, with a projection to go to as high as 144 million by 2025. That's a huge potential there to say that, okay, despite all of the poverty and what we have going on in the country, there's been a significant increase in mobile phone technology usage, even to the grassroots level. So we want to leverage that avenue to also deliver healthcare directly to the people, at the cheapest available price to them. So that is, and also building some kind of health history for them. So anywhere in which they are and all that, they were able to pull up their health record, which is another challenge that the healthcare system is having in Nigeria. So these are some of the things that made us this COVID partner line. We did start out mid last year in responding to the call that NCDC gave for private practitioners to support the fight against COVID-19. But beyond that, is to see how we want to sustain this as a viable platform for healthcare service delivery in Nigeria. So absolutely, I believe it's not only it's transformative in terms of as a solution provider as far as healthcare is concerned. And quite frankly, it is definitely the future. So it means that, even if you're in Borno, Maiduguri, or somewhere in Ekiti State, or, wherever it is you may be, in Enugu, in one rural community, as long as you have a cell phone, you can get access to the best professional in that specialty anywhere that you are. So the person can be sitting right in Lagos, but is able to treat a patient somewhere in Baga, So that's making the world of Nigeria so small that you don't have to travel to, reduce all of those risks. It's the transformative power that telemedicine offers, really.
No, it's really interesting to know this. Hearing it, it sounds so, swaggish, and and it's really interesting. But
Absolutely.
Talk to us basically, when it comes to acceptance of the patient, do they prefer that to meeting doctors on one-on-one? Because sometimes we hear people, they want to connect face-to-face with medical doctors, and telemedicine that is making it easier is certainly going to deprive them of that, because some people feel that if they have one-on-one interface with a doctor, sometimes psychologically they feel that the diagnosis is better than when it is done virtually. But talk to us basically, how are patients accepting this and taking ownership of it?
Thank you. So it's so what we've witnessed now, in the course of the lockdown, there was a significant spike in the number of users of people who call the MedAssist COVID partner line, to reach out to have, so even, we're even dealing with misinformation. So we had people even calling just to find out, oh, I hope I don't have COVID, what are the symptoms, so it is also an avenue to even provide information at the very barest minimum, so necessity, they say, is the mother of invention. People, are forced, because of the peculiarity of the situation, to see a platform that works. And what we've also seen is repeated callback cases of people now who've tried the service. I've seen that, oh, okay, I was able to get the same kind of advice I would get if I walk into an hospital, if I call these people. So the real task for us has been trying to instill that kind of confidence, instill that kind of confidence in people to know that you will get the same satisfaction. So the idea of contextualizing it to languages is part of our efforts to bring it down to the people, to make people make it, as close to them as possible. So if you're European, that's like the language that is more convenient for you. You're talking to a doctor who speaks Yoruba, who is able to relate to you directly. So we try and make it, despite the technology enabling the system, we try and make it as personal as possible. We're able to also provide the same kind of confidentiality in which you would get anywhere else, patient-doctor confidentiality. We ensure that we comply with all of these things that instill confidence in people, and those are the things that we're really putting forward. So it's just a case of us pushing and ensuring that people are aware that you would get the same satisfaction for less personal cost to you. So for as long as that message keeps, we're able to prove ourselves, and people are able to see by engaging in the line, they're able to get that. So I would also encourage you, that maybe you also try one of these days to also call the line and talk to a medical practitioner in your, in the language, in your other language, in your mother tongue language. So maybe you would also be able to get that feeling to be able to measure to say, okay, if you walk into a hospital, what would you get any better treatment? You know, for starters, you'll be attended to immediately in which you reach on the line. You don't have to wait for a nurse to tell you to sit down with 30 minutes, with 1 hour. Then you sit, you know, all those procedures, we've knocked it out. You know, you go directly to speak with a doctor who is now able to take your biodata, you know, and you begin to build a health record. So the first time you use it, you build your record. By the time you come back, we leverage on that. We're not asking you the same old questions. You know, so you know, we build on that and deliver the service to you. So I encourage you to try the line, you know, 08180640000. You know, try and use the line.
All right.
You know, and it will be good to now also get your feedback in terms of, you know, seeing how well that service can be delivered to you, you know, via technology.
Amazing. It sounds good to me. But if you look at it critically on the face value, it looks like it is something for the elite. How about people who live in rural areas and who may not have so much? What is the need for them, and how flexible is this to accommodate people in rural areas or people who don't have the wherewithal?
Absolutely, absolutely. So now a major component of the design for the MedAssist COVID partner line is actually to address that aspect of the population. And going by the numbers of technology penetration or mobile phone technology penetration, and I tried to speak to those numbers earlier. As it stands now, there are 172 million. Okay, as of 2019, the numbers are probably has increased now. You know, according to that GMA report, there are 172 mobile phones, despite Nigeria's poverty indicator. That already says something. Mobile phone is becoming a necessity and not an accessory or something that is now considered to be for a certain aspect of the population. 172 million. We don't even have Nigerians in that number who are above the poverty line. So it means there are a lot of poor people who fall within that World Bank threshold of poor, but they have mobile phones. It might not be a smartphone, but they have mobile phones. So we've deployed this service via the internet. So for some of us right now who have access to smartphones and all that, we can render that service. But people use feature phones. Those are the very big phones who don't have much as texting. It's true to engage with us through the IVR. You know, so you call the line, and we're able to route you directly to a doctor who is speaking the language, you know, within the language offers that we have. So we've ensured that the concept or the platform right now is designed to be able to serve that population. And speaking of the price angle, presently the service is free. We're running the service free in light of the whole COVID situation as a way of actually supporting or stemming the tide of the virus. But even as we begin to move to other illnesses to render the services in other areas, we're ensuring that whatever price in which we charge will be very competitive and tied to the economic standing of low-income households in Nigeria. You know, so for us, it's more of the population rather than it's more of the numbers. So our margin is going to be in the numbers and not in the number of people. We're not looking at 10 billionaires. We're looking at how are we able to provide this service for 10 million people in such a way that those increased numbers are able to still deliver a reasonable margin, profit margin for us. So that's how the business model is designed. We're designed to be able to concentrate in that aspect, because that's where the challenge is. Those are the people who are marginalized. Those are the people who are not getting the best of service. So it's a population model, really. We want to get those numbers. How fast can we reach 1 million Nigerians in those rural communities? How fast can we get the service available to them? So that's really the concept behind the MedAssist COVID partner line.
All right. I'll ask you shortly about the challenges, around the administering of diagnosis through telemedicine. But before then, let's talk about the issue of diagnosis. Are there some classes of ailments that cannot be or should not be advised to be conducted through telemedicine? Okay, so let me first state that, I perhaps have a little limitation to that question in that I'm not a medical doctor, but we have a huge team, a big team of clinicians, headed by a clinical lead who is handling all of those. But by my understanding, presently at the moment now, we're able to provide this service on COVID-19 and mental health. We've built capacity right now to be able to deal with what I call the big three: malaria, typhoid, and your upper respiratory infections, so we're able to deliver that. And we're also moving to skin. Skin is perhaps the most difficult kind of infection to treat, because it requires visuals. You need to see it, you need to be able to tell that. And with the test runs that we've done, we've seen a significant, high increase of efficiency in the ability for our platform to be able to diagnose some of these illnesses. So yes, the limitation perhaps there would be is that at the end of the day,
the best of the service telemedicine can deliver when it moves to you. I mean, you cannot conduct a surgery via telemedicine platform, and if the case requires, there will still be a referral case. However, our leverage is on the bottleneck. Is that okay? How do we ensure that the very basic primary healthcare service delivery is rendered? Those ones right now that rely more on consultation with a medical practitioner, access to a doctor to be able to say, okay, this is what XYZ, what you need to do. But once it begins to move towards you need to do a surgery, you need to book you for, for a diagnosis, for X-ray, those that now require actual physical contact. Of course, so that's where the partnerships come in. Now, on the Telemedicine COVID partner line, now we have referral systems with every primary healthcare center in Nigeria now. So if you engage as somebody from Damaturu calls the system now and is able to talk to a doctor, and we think a referral is needed, we're able to also provide to say, okay, where are you? We're able to track your see your location in real time and tell you how close you are to the nearest primary healthcare center. From our database to say, okay, go this time, see this person. Oh, we can also tell you where the pharmacies are in Nigeria. Where, okay, we think based on what you've said now, you need to actually now purchase this particular medicine and come back to us and all that. So we've been able to build that kind of integrated information system as far as healthcare service delivery is concerned. So we've done that much. But however, when it begins to move to a case whereby you now need to see a physical person, we now do referrals, and we also do follow-up for that. So we're engaging both the patient and also the providers in which we are referring to through this model that we've built. So that's it's also an enabler. So it's an enabler in that sense. So when it comes to you moving to other aspects that's beyond what looking at you directly is, we offer referral in those scenarios.
All right. It sounds really interesting and sounds really good to me. It's like sweet music to my ears when it comes to innovation in medicine and a way of reaching out to people. But talk to us basically just in a minute. What are some of the challenges you face in the usage where medical doctors are using telemedicine to diagnose people? And I wonder how government is supporting this project.
Okay, so in terms of challenges that we face, like I mentioned, one of the greatest challenge, has been adoption. Like we initially spoke to, how well people are able to realize that you can actually be attended to, so it sounds good. I hope that I've been able to convince you to try it out, but I don't have a doubt in my mind that your first trial will mean that you would register in your head as a viable platform for subsequent usage, but for people generally, it's how well we're able to communicate this to the mass, how we're able to get them to believe, to even try it out. So that's been some of the things we started to focus on. What kind of partnerships do we need to begin to get for people to see, for doctors? All of the state governors or even the federal government has healthcare service provision as part of their mandate. But not much has been achieved in that. So there's a need right now to facilitate this kind of partnerships in a win-win way where government and stakeholders are able to see what's in it for them in terms of providing healthcare service delivery for their people. So one of the major challenges has been that adoption. How well can we, increase people's usage of telemedicine as a viable platform? That's been one challenge. Also, there are the challenges of, making sure that you have the best internet provision. You're having very low downtime. You're able to invest in the right kind of facility to enable your system to work. You're also able to get a motivated team of doctors in our clinical unit, people who are able to see that, you were trained perhaps in the orthodox way of saying you have to see a patient physically. How do we get your mind to now begin to see that technology can also be a viable platform for you to render this service, and you feel also as fulfilled as you would feel if you were working in the hospital. So these are some of the things that we've had to deal with. We've had to, manage the clinical unit and stuff for them to be able to get satisfaction from the job that they do by the platforms. Like I would mention, at the start of the project in the advent of COVID-19, we had this significant pool of doctors, even the volunteers, the number of volunteers that the platform, the MMF MedAssist COVID initiative had was significant, because it was locked down. People wanted to be useful. People wanted to participate, so we had a lot of doctors all across. Even, interestingly, we have doctors even from the UK, who were interested in volunteering on the platform to be able to, how can they help? How can they support Nigeria? So we had that. So now people are beginning to transition back to work and all that. Okay, all right. We're seeing a significant drop in numbers, but that definitely is also, so those are one of the challenges. Then just speaking to the government,
I'm afraid we're running out of time right now. But what I'm going to promise is that we're going to have you back to talk about other aspects of this so that people can get to understand it more. And anyone who wants to start using it, how they can access it, we'll have time to talk about all of those. Thank you so much, Opeyemi Orinowo, for your time on the program. Coordinator, MedAssist Program, COVID-19 partner. We really appreciate what you do. Thank you very much.
Thank you.